Hello, Dumela, Hujabu, Kora. I am Sabrina Ludwig, Acting Secretary General of the Namibian National Students Organization, NANSO. Yes, we're all in unprecedented times. We're all anxious, worried, and uncertain of what tomorrow holds. But remember, you are not alone, and we will get through this. In spite of these uncertain times, as young, innovative, and vibrant youth, we must take up space in our societies. We must ensure that we do not sit around, idle, waiting for change, but that we become the change. Study hard, work on that business idea that you've had in mind. Get a new hobby, read a new book, or even write a new book. Be a key asset in your community. Let's deem this as an opportunity to be more resilient, stronger, and innovative. From us to you, be smart and stay safe.
On the 31st of December, 2019, dozens of pneumonia cases were reported in hospitals in Wuhan of the Hubei province in China. At this time, the cause of these cases was unknown. It was just a few days later that Chinese researchers identified a new virus, COVID-19, described as the cause of the pneumonia cases in Wuhan. COVID-19 is an abbreviation for Coronavirus Disease 2019, a disease caused by the severe acute respiratory syndrome coronavirus 2. COVID-19 is believed to have originated from a meat market, also known as a wet market, in Wuhan, China. Scientists also claim the virus likely originates from pangolins, an endangered species that is commonly used in traditional Chinese medicine. About a month after it was discovered, the virus had already spread from China to other Asian countries and the United States. On 30th of January, 2020, the World Health Organization declared COVID-19 a public health emergency. We don't know what sort of damage this virus could do if it spread to a country with a weaker health system, said the WHO Director, General Tedros Adhanom Ghebreyesus. The first COVID-19 case outside of China was reported on the 13th of January, a woman in Thailand who had recently traveled from Wuhan. And by the 19th of January, authorities in the US, Nepal, France, Australia, Malaysia, Singapore, South Korea, Vietnam, and Taiwan confirmed cases over the following days. COVID-19 had then spread to Asia and Oceania, Europe and North America. And on the 2nd of February, the Philippines reported the very first death outside of China. The first case in Europe appeared in France. In late January, the virus quickly spread throughout Europe, especially in Italy, where, on the 24th of February, its first major outbreak, as clusters of infections started to form. In mid-March, Italy reported over 4,800 deaths to overthrow China as the global epicenter of COVID-19 due to having the most reported deaths. The first confirmed case in Africa was reported on Valentine's Day in Egypt. The patient was a German national who died shortly after refusing to undergo isolation. 11 days later, Algeria became the second country to report a case on the continent. Nigeria followed 2 days later to become the first sub-Saharan country to report a COVID-19 case. In South Africa, a group of 9 adult travelers returned from a skiing holiday in Italy on the 29th of February. 7 of the 9 skiers tested positive for the virus, making Italy the most common link to Africa's first coronavirus cases. Egypt and Algeria, both North African countries, were the first African countries to report cases. But why were the first countries to report cases situated in North Africa? And why were all of the first cases in Africa imported from Europe? According to tourism data, North Africa attracts the most tourists compared to other subregions in Africa. Between 2011 and 2014, North Africa was the destination for 47% of all international arrivals in Africa, with Egypt topping the charts as the country with the most visitors at 9.9 million. What is apparent is that travel between Europe and Africa is a large contributing factor to why the cases in Africa are linked to Europe, especially given travel restrictions were implemented earlier in China than across Europe.
We look at COVID-19 and really most infectious diseases, how they are spread. Obviously, travel is a very big part of it. Because again, if we look at the index case that Nigeria had, it was an imported case, an Italian that traveled back to his base in Lagos in Nigeria. So, and if you consider the fact that Nigeria is has the largest population in Africa, and the fact that the traffic in Lagos airport is more than the whole of West Africa combined. So if you look at that and the fact that, people travel all the time, from different parts of the world, and in this case from Europe, and in particular Italy, you would understand why it was easy for Nigeria to be the first of Sub-Saharan Africa to report a case. So I think I'm going to pen it down to the ease of travel and the volume of traffic coming to Nigeria, and in particular the volume of travelers that come to Lagos.
But there is more to why Europe was the source of Africa's first cases. Europe is not only Africa's largest source of international visitors, but according to the Africa-Europe Alliance, an official partnership between the African and European Unions, the EU was Africa's biggest trade partner in 2018, and arguably today, at least, before the peak of COVID-19. The first cases reported in Africa were firstly classified as sporadic cases, with clusters of cases occurring thereafter. Sporadic cases are one or more reported cases that were detected in a country in which a patient did not contract the virus, which is what the very first African cases were, travelers coming from Europe where they had contracted the virus but tested positive upon arrival in African countries. Shortly after the sporadic cases, cluster cases began occurring. They are a group of COVID-19 cases that occur at the same location, from the same source, in relatively the same time period. COVID-19 became an even more serious public health concern when cases started being transmitted within communities. South Africa, Algeria, and Tunisia became the first countries to record outbreaks of community transmissions, which are cases that occur as a result of infected people coming into contact and spreading the virus to other people within a country or area. 12 days later, the WHO reported more communally transmitted cases in Guinea, Burkina Faso, Nigeria, and Mauritius, bringing the total count of countries with communally transmitted cases to 7. Senegal later joined the list, and as communally transmitted cases started occurring on the continent, people grew more worried about the growing number of possible unreported cases. However, a controversial country became apparent amidst this fear: Egypt. Although the total number of cases of COVID-19 in Egypt continued to rise, Egypt did not report any confirmed communally transmitted cases as of May 18, 2020. Egypt is still documented as only having clusters of cases. The Egyptian government is making it very hard for transparent and accurate reporting after criminalizing the spread of fake news, putting the media in a tough position when reporting on COVID-19. On the midnight of 22nd March 2020, Rwanda imposed the first lockdown in Africa. The government in Rwanda banned all social activities and non-essential travel. This meant that people were only allowed to leave their homes for food or medical care or other essential services. Churches were not permitted to open, and religious gatherings were banned. People did not take lightly to the new rules, and many were testing the seriousness of the police. People were arrested, and some even died, trying to fight back against the enforcement of the lockdown laws. Morocco and South Africa soon followed. African countries that quickly imposed lockdown measures and closed their borders were able to keep the initial infection rates stable, allowing for a maintainable early spread of the virus. This allowed countries in Africa to produce the necessary supplies and facilities needed to treat COVID patients. Without this period, these countries would have insufficient medical supplies and could face death rates to the likes of France and Italy. Some countries in Africa also have experience in dealing with pandemics and viral outbreaks, such as Ebola and malaria, aiding them in preparation for the COVID-19 pandemic. Some countries eased lockdown measures early and had seen rapid spread of the virus soon after. This is what happened in Nigeria, where the country recorded a record number of new cases on the first day of its 6-week plan of easing lockdown measures. Egypt quickly became an epicenter for the virus in Africa and saw a very high initial spread rate. This could be due to a combination of the high level of tourism, a lack of testing, and the late implementation of lockdown measures. Not all countries went into lockdown. Some had no choice but to keep their borders open for trade, as they had no other means of receiving essential goods such as food. Uganda had seen a rapid early increase in cases, largely due to truck drivers delivering goods from Tanzania, while Tanzania refused to implement lockdown measures. Tanzania largely put the economy first. "God will help us," said Tanzania's President John Magufuli. Magufuli prioritized the economy and encouraged the use of prayers and faith to protect the country from the virus. There is some controversy revolving Tanzania's case reportings, as they have not regularly reported and revealed cases. And there were many reports of media censorship, as government would apparently impose harsh sanctions on media relating to case statistics. In the first days of March, Egypt, Algeria, and Senegal had the highest infection rates. But once South Africa recorded its first few cases, South Africa and Egypt, followed by Algeria, became home to the highest infection levels in Africa. South Africa used the time of lockdown to prepare for a large influx of COVID-19 patients by setting up field hospitals, allowing hospitals to acquire and establish facilities, and allowing organizations to set up internal safety standards. However, despite some of the strictest measures in Africa, it had quickly become the African epicenter of the virus. With 2 major international airports and a dense urban population, Gauteng is the economic hub of South Africa. Gauteng, along with the Western Cape, proved to be fertile ground for the virus due to the high percentage of its populations relying on public transport to commute to work and the high volumes of business travel. Millions of individuals travel daily via tightly packed buses and trains. Together, the Western Cape and Gauteng are home to about 75% of cases in South Africa. Countries all over Africa have a large level of underlying conditions within their populations. About 20% of South Africans are infected with HIV, while TB is also common in South Africa. This puts South Africa at risk of a fatality rate due to pre-existing conditions leaving people especially vulnerable to COVID-19. Most African countries are facing a major lack of infrastructure and medical resources needed to treat a virus that spreads this fast. And there is no cure as of yet. Many countries do not even have the resources to sufficiently carry out tests, leaving room for undetected and more rapid spread of the virus. During already tough economic times, Africa faces a dilemma. Continue lockdowns and put strain on the country to prevent the spread of the virus? Or open up economies but risk the spread of the virus and the deaths of hundreds of thousands of people and face the same consequences as Europe? In our next episode, we will take a deeper look at what lockdown looks like in African countries and how governments are making sure people follow the rules.